Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Hi, everyone. Welcome back to the Breast Cancer Podcast. And I'm Dr. Deepa Halaharvi, a breast cancer surgeon, survivor, and the host of the Breast Cancer Podcast. Today's podcast is really personal to me. It's not just a medical conversation, it's a cultural conversation, it's a family conversation, it's a community conversation. For many of us, this conversation has been avoided for way too long. And today, what are we talking about? We're talking about breast cancer in the South Asian communities and why it matters, why silence can be dangerous, why the conversations we avoid are often the ones that could save our lives. And in so many South Asian families, we are taught to endure, some of these things. But today, I am so grateful to have Dr. Kavya Krishna. Welcome back.
Thank you.
And she is a medical oncologist here in Columbus, Ohio. We are both South Asian origin. And so very excited to be here to tackle this topic because we do get a lot of questions about breast cancer in the South Asian communities. Dr. Krishna, thank you so much for being here
Thank
today.
you for having me.
Why do you think, Dr. Krishna, it's important to talk about breast cancer in South Asian communities?
So I think one of the key things with talking about the South Asian community in general, and we have to be aware of some of the cultural factors
Yeah.
that come into play. So when we talk about breast cancer, awareness is very important.
Yeah.
And women having awareness that they need to get screening and being proactive about that is extremely important. There could be lower rates of that happening in the South Asian community due to some cultural factors like modesty, feeling shy about talking about any symptoms related to breast health, and just ignoring oneself and putting their family first.
Yeah.
That is one of the common mindsets
Yeah.
that we do
Yeah.
see in the South Asian community. And also the lack of awareness that breast cancer can happen in South Asians. The prevalence is increasing. Just knowing about that, becomes important.
Yeah. Yeah. I agree. And a lot of the culture, they don't feel comfortable talking about it in our families. We don't talk about cancer. So we don't grow up knowing these things, right? It's something that we are learning now. And is breast cancer less common in South Asian women compared to Western women?
I think that's a very good question. And when we look at the incidence and prevalence of breast cancer, when we go back in time and we look at the historical data that we have from South Asia itself, it was probably not as common as the Western world, but that's rapidly changing. So I do think that the risk of having breast cancer is rapidly increasing in the South Asian population, and it could be because of numerous factors. And one of the big things that probably leads to this increased incidence and prevalence could be the changes in lifestyle.
Okay.
So there are increasing rates of obesity across the globe, and it's especially metabolic syndrome that
Yeah.
happens in South Asians.
Yeah.
Especially puts women at a much higher risk for developing breast cancer.
Right. And also, I also see across all cultures, like women, we are more into our education, into our careers, and so delaying childbirth, and of course, obesity and not getting married, like younger ages that it used to happen before, early periods, late menopause, like those are the risk factors across everywhere. And do South Asians tend to present with cancer later than other population?
That's definitely one of the things that we observe, and
Yeah,
it could be due to multiple factors.
right.
Um, One factor could be that cultural modesty
Yeah,
and some hesitation
right.
about seeking care,
Yeah,
even when there are subtle symptoms.
yeah,
There could be lower rates of screening
yeah,
in the South Asian population.
yeah,
So women may wait till they
yeah,
develop symptoms before seeking care.
yeah.
And there is also concern that sometimes cancers may have slightly aggressive biology in
Right.
the South Asian population. So,
Yeah.
what we mean by that is when cancers tend to have a more aggressive biology, they may grow faster. So,
Right.
once the cancer forms in the breast, it can get bigger quicker,
Yeah.
and it can spread to the lymph nodes and distant areas. So it is, these are all the factors
Yeah.
that probably come into play
Yeah.
when we talk about South
Yeah.
Asian women sometimes presenting with more advanced
Yeah.
cancer or at later stages of
Later
the cancer.
stages. Yeah. And again, a point that I do want to make here, and it's we talk about this in pretty much every time we talk about cancer is earlier detection leads to better prognosis, better survival. So if you find your cancer before I can actually feel a mass, meaning you're getting your regular screening mammograms, and that usually happens around age 40, once a year, every year. You do get diagnosed with cancer much earlier than women who present with a mass. Even then, most of the time women get diagnosed with cancer pretty earlier stages, as long as you're advocating for yourself, doing a breast exam and so on and so forth. Is there any sort of genetic differences between the South Asian women and Caucasian women?
So I think the genetic predisposition or different germline mutations
Yeah.
or something that we are born with,
Yeah.
which can dictate our risk for getting cancer. This could be underreported in the South Asian population. And it could be due to multiple factors. One, it goes back to potentially some lack of awareness, not in all situations, but that could be part of it in certain groups. It could be not being aware about the significance of family history.
Right.
So, for example, when we have a person with a family history of
Yeah.
ovarian cancer,
Yeah.
it may not be breast cancer, but
Right.
kind of making that connection
Right.
so
Right.
that there could be a genetic
Genetically.
predisposition
Yeah.
in the family of a BRCA mutation
Yeah.
or something similar.
Yeah.
Just having that awareness. So it goes back to under estimating the amount of genetic predisposition that could
Right.
happen in the
Yeah.
South Asian population, and awareness could be a part of it.
Yeah, yeah. That I do agree. I think, making that connection sometimes is hard. And sometimes families don't even talk about it, right? I think that's extremely prevalent in South Asian cultures where families don't talk about their family history, which I think it's really important. And one thing you take away from this podcast is make sure you're talking to your families about family history of breast cancer. Is there anything else that makes them unique in a sense, like, are we just made differently? And does that predispose us to cancer, not just breast cancer, but
I think there are several
yeah,
factors. One, it could be that South Asian women may have denser breast tissue,
yeah,
which can make the detection of earlier stage cancers or smaller masses
yeah,
much more challenging with the routine mammogram.
yeah,
So that could definitely
right,
be one of the factors.
yeah,
And we did touch upon obesity
Right.
and the central obesity that could be present in South Asians.
Right. Right.
And one of the unique things about the South Asian population is that the usual BMI or body mass index cutoffs that we use in the Western world
Yeah.
are not applicable to the South Asian community.
Yeah.
We know based on very strong evidence that South Asians can develop cardiovascular disease and other metabolic syndrome
Yeah.
related diseases
Yeah.
at a much lower BMI. So
Okay.
when we look at the BMI cutoffs and we, look at who are the patients who are in the normal BMI
Yeah.
range, who are the patients who are in the overweight range,
Yeah.
or who are the patients in the obese range, the cutoffs that we have are very different for the South Asians. So, for example, if we look at obesity, the BMI cutoff is 30
Yeah.
for the general population.
Yeah.
But for South Asians, it can be as low as 25 or a little bit higher than that.
Wow. Wow.
So their risk is very much different
Yeah.
if we use the regular parameters that we have. So awareness about the enhanced risk
Yeah.
that the South Asians have is very important. And this kind of goes back
Yeah.
to also the fact that South Asians can have higher visceral fat, that
Okay.
is storing the fat in the organs, in the
Yeah.
internal organs. And that does increase their risk for developing metabolic
Is
syndrome.
that the skinny fat that we often
That
refer
is the
to?
skinny
Yeah.
fat.
Yeah.
Yes.
Yeah.
So we could have somebody who looks perfectly healthy on
Yeah.
the
On the outside.
outside. They
Yeah.
have a normal BMI, and they could have much higher risk of cancers, especially breast cancer, colorectal
Yeah.
cancer,
Yeah.
as well as cardiovascular
Cardiovascular.
diseases and stroke.
Yeah, I really think that's a very fascinating fact about South Asian people. And I honestly did not know that we are considered overweight and obese at a lower BMI than what you would traditionally consider here. That, was eye-opening for me. And I'm afraid to look at my BMI because I'm probably going to be obese in the BMI. So,
But BMI is a very general term
right,
because
right.
we also look
Yeah,
at how much muscle mass
right.
somebody
Exactly.
has.
Exactly.
So I know
So
you
I'm
are
going to go with
somebody,
the muscle
yes,
mass than the fat. But you know what, though? I think knowledge is power again. It's good to
absolutely.
know these things.
Yeah.
And in terms of the symptoms, I have noticed that women presenting with symptoms are typically the same as anybody else: breast masses, nipple discharge, skin changes, lymph nodes that are enlarged underneath the arm, pulling up the skin or the nipple. There's typically what's called put orange, which is like orange peel appearance of the breast. That could be one of the symptoms. And obviously, the mammogram abnormal imaging, sometimes, that would be the way of presenting for cancer. Do you notice anything different than that?
No, I agree with you.
Yeah.
I think the symptoms related to breast cancer,
Yeah.
they're kind of universal.
Yeah.
They're
Yeah.
common for all women.
Yeah.
And I don't think that there are any, unique factors or differences in South Asian women.
Yeah.
One thing I would add is, if we are talking about some of the color changes that can
Yeah.
happen in the breast,
Yeah.
sometimes that can be harder to
Harder to
detect
detect
early
because of the
on.
color, because of a darker color. Yeah.
Yeah.
Yeah. Yeah, I agree. I do think that that can be difficult to detect. But, having said that about the breast masses, I will say the most common mass is not breast cancer. Most of the time it's benign, but you don't want to panic. You do want to get it, checked out and see your doctors, and you don't want to wait. Cancer does not get smaller if you wait. So, but if it's not cancer, at least you'll know that for sure. Why is screening so important even without any symptoms?
I think, this is one of the most powerful tools that
Yeah.
we have against the fight against breast
Against breast
cancer.
cancer, yeah.
Because screening, even in the absence of symptoms, is something so powerful. It
Right,
helps us in picking up cancers very early.
right,
And I
right.
can speak from a medical oncology perspective
Yes.
that, when we pick up cancers at when they're much smaller, when they haven't really spread to the lymph nodes, they're early stage
Yeah.
breast cancers,
Yeah.
and we could get away with less treatment.
Right.
and still maintain very high rates of cure.
Right.
And I know that it also plays a role
Yeah.
in your surgical
Right, right.
decisions.
I always love it when I have the option of doing a lumpectomy versus
Mhm.
mastectomy. I hate it when I have to tell a patient you're not, a candidate for a lumpectomy because, then it doesn't give a patient a choice. But if you're getting diagnosed in early stages, in America, we say 1 in 8 of us will get diagnosed with breast cancer. You could have a lumpectomy with radiation, same survival as a mastectomy. If you get early stage cancer, better survival, lesser treatment, less invasive, procedures. And it just gives you a better option, better quality
Mhm.
of life, better body image. And you're just giving yourself a best chance of, getting through it. And so
Absolutely.
it helps in every aspect.
Absolutely. So, Dr. Halaharvi, along
Yeah.
those lines, I know, we have kind of talked about how South Asian women can have higher or more dense breast
Yes.
tissue.
Yeah.
Do you want to speak a little bit about how the screening could look different for
Yes.
them?
Yeah. So basically, dense breast tissue is that you have a higher fibroglandular tissue in your breast that basically it just your breast tissue just looks white on mammogram, and cancer looks white on mammogram. So sometimes cancer can hide behind the dense breast tissue. So typically we add an ultrasound or an MRI. If you're younger women, we may do both of them. So it does change in what type of imaging that we get and how we follow you in the future. So, and I do think, like you alluded to earlier, South Asian women do tend to have dense breasts. We see that in younger women of, all ethnicities is denser breast, which can be difficult in detecting cancer sometimes.
Absolutely. And I think sometimes when we talk about dense breast tissue, it's now important to look for that
Yeah,
in as a patient
yeah,
in your report. So if you see that there is dense breast tissue, then advocating for yourself and talking to your physician whether you would be a candidate for additional screening other than doing your yearly
that is
mammogram.
correct. That is correct. Insurance mandates, paying for additional screening across all the states in at least in the United States. So advocate for yourself if you're told that you have dense breast tissue. Does the biology of the cancer in South Asian women different? And along the same lines, is the treatment different in South Asian women?
That's a very good question. So, when we are making treatment decisions for breast cancer, we really look at the type of breast
Yeah,
cancer. And when I say type of breast cancer, I'm really referring to the receptors.
right,
So there
right.
are three receptors,
Yeah,
estrogen, progesterone. So these two are the hormone receptors, and there's a third receptor called the HER2 or HER2
yeah,
receptor. So this is super important. So when we get a diagnosis of breast cancer, we typically don't make any treatment decisions till we know the receptor
yeah.
studies. So when we look at patients who have, South Asian origin
Hmm.
and looking at the biology of their cancers, we do see that they can get any type of breast cancer.
Yeah,
It's not, unique to have just one type of breast cancer,
yeah.
but we tend to see slightly more aggressive biology of the breast cancer
Okay,
in South Asian women.
okay.
And our treatment decision is really based on
Yeah,
the subtype of breast cancer.
okay.
So, if somebody has a more aggressive biology, such as triple negative breast cancer or HER2
Hmm.
positive breast cancer,
Hmm.
chemotherapy, which is a more aggressive treatment, can also be a part of that treatment
Hmm.
plan.
Hmm. So it's important to know that your biology could be different, and which could then alter the type of treatment that you get.
Absolutely.
And it's and we talk about this on other podcasts too, as the multidisciplinary team that we work together. We are part of a tumor board where we get together medical oncologists, surgeons, radiologists, radiation oncologists, genetic counselors, nurse
Mhm.
navigators. There's a number of us. We get together. We talk about the best treatment plan for that person based on their age and the stage of their cancer and what would be the best thing for them. So you do want to, look for those type of, breast cancer centers where you have, ability to for your cancer case being presented and you get personalized care. It's not one size fits all. So the treatment approach really does matter in your overall treatment and survival. One thing I have noticed in my own family is we don't talk about family history. And I know we alluded to
Mhm.
that earlier a little bit. It's really important to talk about family history because, like you said before, the genetic mutation, sometimes we don't connect the dots. If you have ovarian cancer, there's a possibility you could have BRCA mutation that could then cause breast cancer.
Mhm.
And then also, then it allows you to get screenings for other cancers. So you're empowering yourself by
Absolutely.
knowing the genetic mutations. So,
Absolutely.
how can families better support South Asian women as they're going through cancer diagnosis?
I think families play a huge role.
Yeah,
And one thing about South Asian community is the family structure is people tend to be very supportive and they're very close. But South Asian women tend to carry a lot of the weight of running the household
yeah,
and
yeah,
taking care of the family. And when they get diagnosed with cancer, I think it's very important to recognize and for families to realize that, she needs help and kind of coming together and supporting her through the whole journey.
yeah,
So, families can play a huge role. And
yeah.
we talk about this even at our
Right,
multidisciplinary
right,
meeting,
right.
what are the supportive care needs each patient has. And this is where I think open communication
Yeah,
and families working together to support the woman to get through her treatment well
yeah,
becomes very important.
right.
And also for the patient, just having the willingness to accept help
Right, right,
becomes very
right.
important. And sometimes that can be
Very
very
challenging.
challenging,
Yeah,
and
yeah,
it's got to be something that they may not be comfortable with,
yeah, yeah,
but it becomes important that
yeah,
they start accepting help not
yeah.
as a sign of weakness, but as a part of their journey and the self-care that they
Yeah, it's
need.
actually a sign of strength, I think, to
Yeah,
ask for help because,
absolutely.
like we talk about, like someone who is wanting to help you, they really want to do something for you, and you're blessing them by allowing them to help. And also, it's also a good time to talk to your kids about the cancer diagnosis. You don't want to keep it hush hush. Kids, can feel something is going on in their lives, and just to keep it age appropriate, to keep it simple, and say, "I'm diagnosed with cancer. I can get through it," and it would be amazing to see how your kids turn out very compassionate and kind, watch their mother go through it.
Mhm.
It's very powerful, and you want to use that situation to help them grow because adversities are part of life. If it's not breast cancer, it's something else, and you're helping them grow and navigate through these type of situations. And it's important, like as a surgeon, I know, like, giving up control, having other people help you is very difficult, but knowing that this too shall pass and you getting better, then you can take care of your family members. So I have some myths I want to dispel in the South Asian
Okay,
community. Are you ready, Dr. Krishna?
absolutely.
Okay. Breast cancer won't happen to us, true or false?
False.
Yes, that's this whole episode is that, right? We're
Mhm.
talking about how breast cancer doesn't discriminate whether you're white, black, South Asian, rich, poor, young. I mean, it doesn't matter. So it
Mhm.
doesn't discriminate. Talking about breast cancer brings bad luck, or talking about any cancer brings bad luck.
False.
Yes, absolutely. If anything, it brings you power, it brings you
Mhm.
empowerment. You can advocate for yourself. So it's really important to talk about it. Mastectomy means end of femininity. What do you think of
False.
that? Yeah, absolutely. And as someone who's had a mastectomy, I don't feel less feminine now than I did before. And it's just part of your body. It's not everything. And I 100% agree that it doesn't end femininity. And it's, also it's a lot of it is your mental, like what mental image of yourself. And that's really important to work with yourself to get there where you're comfortable in your own skin. Strong women don't need help.
Absolutely false.
Absolutely false. I'm going to say high five to
Yes.
that. We consider ourselves really strong and we rely on our spouses,
Mhm.
as Dr. Krishna just witnessed me about, asking my husband for some things around the house here. So, and strength is really not silence, it's pretending, not pretending you're fine. You really, don't want to avoid the care. Real strength is facing what's hard, asking questions, seeking treatment, letting people help you. And what is your message to South Asian women today?
I think we have to take it up on ourselves to really break this generational silence.
Yes, absolutely. 100%.
It's very important.
Yeah. The generational silence, breaking that is really important. So I make it a point to talk to my daughter about these things. I'm actually doing a mother-daughter event for Mother's Day this year, especially talking about, health and taking care of yourself and exercising. And those things are really important. And, more than anything, it's important to love yourself. It's important to love yourself, important to love your daughters, love your sisters, love your mothers, and also love those women who will come after you. And every conversation has the power to break that silence, and it empowers your family. And this was a wonderful episode. Dr. Krishna, thank you so much for taking the time out of your busy week to be here. This is going to be so helpful, not just to South Asian women. Anyone that's listening to this conversation is so empowering. I've learned so much, and I'm not going to check my BMI today, but I'm going to say it's because of the muscle and not fat.
Thank you, Dr. Halaharvi. It was great to be here.
Yeah, thank you so much. I know you're very busy, and it's such an honor to have you. And if this episode resonated with you, please share it with others and give us a 5-star rating. And this is one topic our community cannot afford to whisper anymore. And thank you for joining us today at the Breast Cancer Podcast. I'm Deepa Halaharvi. Until next time, keep choosing knowledge, keep choosing courage, and keep showing up for yourself and others. Thank you so much. Bye-bye.
Bye.
Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice, so please talk to your medical professionals.